Hi everyone, welcome back to Neurospicy Nursing. It's your favorite ADHD friendly study buddy. I'm here to help turn nursing chaos into clarity. Today it's just a little quiz on some anti-ineffectives, and at the very end I've included some HIV questions as well. So we'll be going through that as normal. If you haven't had the opportunity to go over the question before this video, I will allow time for you guys to go ahead and go through that. Um, but that's pretty much it. Let's go ahead and get started. If you haven't already done this first question, I'll give you the time to now. And the correct answer to this one is going to be vision changes. So remember that hydroxychloroquine, we've seen it in the past when we've talked about lupus and other autoimmune conditions. It can cause retinal toxicity. That is a sign of toxicity. Specifically for hydroxychloroquine, it causes something called bullseye maculopathy, and that's what causes the blurred vision, color changes, and vision loss. Also, we have to make sure that these people are getting baseline and periodic eye exams to make sure that they aren't having any of those toxic signs. Another thing that um, to keep in mind with this is that seizures can technically happen as a side effect of the medication, but that's going to be really rare. And then for this medication, hearing loss and tendon ruptures aren't typical. But specifically, correct answer for this was B, the vision changes. All right, I'll leave you some time for this one. All right, so the correct answer for this one is actually going to be B, depression and anxiety. So mefloquine, it's actually contraindicated in individuals who have psychiatric disorders, because it increases your risk for those neuropsychiatric effects. So you have an increased risk of depression, anxiety, and psychosis with this medication. Um, all of these other ones, seasonal allergies, the appendectomy, lactose intolerance, they have nothing to do with this medication. So you're worried about depression, anxiety with these patients. All right, so the correct answer to this one is going to be A. It prevents relapse by targeting dormant parasites in the liver. So the specific medicine, the avodaquone, you guys know me, I can't pronounce things. I don't know if I'm pronouncing that medication correctly, but it's often used in combination with another medication called proguanil. And those are going to specifically target the hepatic forms of malaria and also something called blood skin schizonets. I don't really know how to pronounce it. It's spelled schizont, but they're dormant parasites that are in malaria. And by targeting those specific dormant parasites, what you're gonna do is prevent the relapse. So think about it like TB. TB can sit latent in your system, and then something can cause it to reactivate. So the same thing's gonna happen for these dormant parasites. They can reactivate. So if we're targeting them, it's preventing them from reactivating. And especially for people who have those different liver stages, um, it's really gonna help with preventing that relapse. All right, the correct answer to this one is going to be notify the provider immediately. So C, we talked a little bit about it for the first question, but again, blurred vision is a sign of retinal toxicity, and it's a bad sign in hydroxychloroquine. So they have to make sure that they get promptly evaluated, and they're potentially going to be discontinued from this medication, because we don't want to cause permanent damage. All right, so the correct answer to this one is going to be B. QT prolongation leading to torsades, especially with the combination of Zofran. Zofran in itself already has that risk of torsades. If you don't know what torsades is, it is a deadly heart rhythm. It literally looks like squiggles on an EKG. But when we're using them together, especially if this person has, let's say they have a potassium imbalance or they already have a heart condition, that QT prolongation is really something to watch out for, especially with the combination of the Zofran. Um, the other symptoms like hearing loss, SJS, and hepatotoxicity, um, they are less characteristics for this medication with the combination with the co specific combination of Zofran. So that's why we're really looking at that QT prolongation. All right, so the correct answer for this one is going to be B. It prevents the relapse in latent parasites. We just kind of went over this. By making sure that you're completing an anti-malarial therapy, it really ensures the full eradication of the parasite, especially those who have the hepatic stages, to prevent that relapse. It's not really an antibiotic resistance because again, this is a parasite. So we're not worried about a bacteria. Antibiotics are for bacteria. That's why we prescribe them. So there should be no antibiotic resistance mechanism here at all. And even though the GI upset and the photosensitivities are side effects of the medication, again, it's not the reason why we need to make sure that we're doing the full course of medication. The full course of medication is because we want to prevent a relapse of malaria in individuals. All right, so the correct answer to this question is going to be B. We're going to stop the medication. We're going to notify a provider. The reason is because this specific drug class of antibiotics is very notable for causing ototoxicity. So these individuals are going to get like tinnitus and stuff like that. So we have to make sure that, especially since in this case they have new ringing in their ears, it's not something that they've had for an extended period of time, that tinnitus and hearing loss is associated with the aminoglycosides. So, new ringing in the ears immediately will warrant cessation of the drug, and we're going to evaluate them to make sure that they don't have any permanent damage. All right, the correct answer to this one is going to be B, nephrotoxicity. Gentamicin is it commonly causes kidney injuries. And obviously, kidney injuries, they're reflected by an increase in your BUN and your creatinine. Hepatotoxicity, neurotoxicity, and toxicity, while they are side effects of this medication, it's not the primary concern because we have already elevated renal markers, so we're going to be worried about their kidneys. All right, the correct answer to this question is going to be A, QT prolongation. Macrolides, like azithromycin, that's the drug class of macrolide, can prolong the QT interval, which can cause palpitations and arrhythmias. Um, for the other ones, none of those are really consistent with this medication. So really, in this case, we're really looking at that QT prolongation. And again, this kind of goes back to that other question. If it's in combination with another medication that can prolong the QT interval, if they have any past medical history of some cardiac event, we're really going to make sure that we're monitoring these patients for that prolonged QT interval. All right, the correct answer to this one is going to be A, stop the infusion and notify the provider. So any flushing and redness during vancomycin can suggest something called red man syndrome or vancomycin flushing syndrome, depending on what you've heard. But it's an infusion reaction. So as a nurse, our priority intervention is going to always be to stop the infusion. And then any subsequent management will be after the provider has, look them over and see if it was just like a regular allergic reaction or an actual infusion reaction like red man syndrome. So first thing that we're going to do is going to stop the infusion and notify the provider. All right, the correct answer to this one is going to be A, wear sunscreen and UV protective sunglasses. Doxycycline or any tetracyclines can cause photosensitivity. So patients really need to make sure that they're using sunscreen whenever they go out and they're wearing protective clothing and eyewear. Um, for the avoid the dairy products, that more relates to the absorption timing, not the risk for sun exposure, so that you're not really worried about that. And the bedtime dosing and the folic acid, again, not the teaching priority when we're talking about the sun exposure. All right, the correct answer to this one is going to be A. So tetracyclines cause esophageal irritation by causing something called pill-induced esophagitis, and That's with that is when you're not taking it with like an adequate amount of water or you're taking it immediately when laying down. You really should be telling these patients to take it after sitting up for 30 minutes, but if your patient is someone who, you know, maybe can't sit up for 30 minutes because of some sort of like skeletal muscle issue or neurological issue, this might not be a good medication for them. We might have to switch them to something else. Um, but again, we're really making sure that they are sitting up after they're taking this medication and taking it with an adequate amount of water, at least 8 ounces, to try to prevent that pill-induced esophagitis. And those symptoms are going to be the heartburn, as well as the chest pain that they're getting. All right, for this question, the correct answer is going to be B, stop the medication, notify the provider. Fluoroquinolones, they have an increased risk of tendon rupture or tendinopathy, especially in the Achilles tendon. And it can actually cause an Achilles tendon rupture. So any pain in that area will warrant almost immediate discontinuation and evaluation of this medication. We don't want to have them stretch or continue any um, walking or anything like that to kind of stretch it out, because that can actually worsen the injury and actually cause the tendon rupture. All right, the correct answer to this one is going to be A, Stevens-Johnson syndrome. So when we're talking about this medication and any sulfa drugs, and sulfa drugs also do include like medications like Lasix, they are under that cusp-ish of sulfa drugs. But sulfa drugs, sulfonamides specifically, can trigger those cutaneous reactions like SJS and like 10. And these individuals present with blistering, and it almost looks like their skin is like kind of like burning, has been burnt and like peeling off almost. Um, and sometimes they also have mucosal involvement, so their mucosa is going to be very dry and cracked. Um, and they'll have flu-like symptoms as well. For Redman syndrome, it's not something that's going to be associated with sulfa drugs. Redman syndrome is something that's just um, really for vancomycin. So make sure that you know the difference between SJS and Redman. So one is more a rash, which is the SJS, versus Redman syndrome is flushing. Their skin's not going to peel or anything like that. So make sure that you know the difference between the two. The correct answer to this one is going to be A, cross-sensitivity allergic reaction. I just talked about how sulfa drugs and furosemide, which is Lasix, are technically in the same drug class. So if you have an allergy to one, you will have an allergy to another. So if um, they do get put on something like furosemide, and you have to make sure that we are very, very vigilant for that hypersensitivity, especially if this individual has no other options for, in this case, diuretics that they have to take. All right, the correct answer to this one is going to be A, administer the epinephrine. So, any angioedema, difficulty breathing, we're worried about their airway, breathing, and circulation, right? That is going to be the most important thing for our patients is their airway, breathing, and circulation. So, this individual is having an allergic reaction based on kind of the signs that we're seeing, the difficulty breathing, so that airway is narrowing from the inflammation in that airway, and then that facial swelling, that angioedema is another sign of an allergic reaction. So the very first thing that we're going to do for anaphylaxis is administer epinephrine. That's always the priority. The next thing that we're going to do is make sure that we've give them airway support and any other emergency management. And while we do have to document, chances are we're not going to continue that therapy. All right, so the correct answer to this one is going to be A. I kind of messed up the slide a little bit here, but penicillin G, if a patient is pregnant, even if they're allergic to penicillin, the only treatment for syphilis when an individual is pregnant is going to be penicillin G. So we have to make sure that they're taking some sort of antihistamine to kind of lo lower that threshold to prevent an allergic reaction. All right, the correct answer to this one is going to be A, a cross-sensitivity reaction. Cephalosporins have cross-sensitivity reactions with penicillins, especially in patients who have history of um, intermediate or severe reactions to penicillin. Um, Nowadays, the risk is a little bit lower than once was thought with like the cross-sensitivity, just because there's so many generations of the cephalosporins. But you still have to make sure that if you have a patient who has a penicillin allergy and you're giving them a cephalosporin, that you're watching for that allergic reaction. All right, the correct answer to this one is going to be A. This is expected, wear glasses instead of contacts. Specifically for rifampin, it does this very strange thing, and it's a normal side effect of this medication. It doesn't mean anything is wrong, but orange-colored tears and other bodily fluids, it's just a side effect of the medication. Um, and you want to make sure that you're not wearing contacts because it can actually stain the contact lenses. Um, and again, it's something that's benign and it's inspected. They should be wearing their glasses. It doesn't indicate any hepatotoxicity, and it doesn't mean that they're having any sort of adverse reaction to the medication. All right, the correct answer to this one is going to be A, vitamin B6. So since isoniazid can cause peripheral neuropathy, that's where we see the numbness and the tingling in the hands. Um, what it does is deplete something called pyroxine. Um, by supplementing the vitamin B12, it helps prevent and treat that neuropathy like symptoms. These other vitamins aren't really helpful for that peripheral neuropathy, but B6, whenever you see numbness and tingling in the hands and it's related to peripheral neuropathy, vitamin B6 is always going to be the answer because again, these medications they they deplete it in the body. All right, the correct answer to this one is going to be A, hyperuricemia. This medication can increase uric acid levels and can cause gout-like symptoms. Um, and that's pretty much really all you really need to know for this question. You have gout-like symptoms. Once stopping the medication, though, for the most part, as long as their kidney functions are normal, it should go away. Because again, your kidneys are going to help filter out that uric acid. Um, and they shouldn't have to be put on any long-term gout medications. But it is normal if they've been on it for a little bit of time that they're going to have that elevated uric acid level and those gout-like symptoms. All right, the correct answer to this one is going to be A. Stop the medication, notify the provider. Ethambutol can cause optic neuritis. So, optic neuritis is blurred vision, color changes, color vision changes, all of that. So, we have to make sure that we're immediately stopping this medication and they have to go get evaluated by an ophthalmologist because we want to make sure that there was no permanent damage that had occurred. All right, the correct answer to this one is going to be A, antivirals slow down viral replication but do not eliminate the virus. This is super important. Viruses, once they are in your body, they stay there. They do not go away. So anytime you are on an antiviral for whatever the reason, it's not going to get rid of the virus. All it does is slow down the replication, similarly to how the antivirals work for HIV. We're decreasing the viral load of the virus in their system to hopefully get it to undetectable levels. But if they were to stop the medication, the virus is just going to continue to multiply. So the same thing's going to happen here. Once you get herpes, you have herpes for the rest of your life. It's just dependent on whether or not you have active lesions or not, because you'll just have almost like a latent herpes. So again, the correct answer to this question is going to be A. Antivirals slow down the viral replication but do not eliminate the virus. All right, the correct answer to this question is going to be electrolyte imbalances. It is extremely important when we're taking this medication, this antifungal, to monitor the um, magnesium and the potassium levels. Because of the fact that it is super duper electrolyte wasting, that means it causes the electrolytes to be excreted more from the body, and it's also nephrotoxic. It's the two that is really going to waste are the low potassium or the potassium and the magnesium. So we have to make sure that we are monitoring that. Yes, QT prolongation can happen from an electrolyte imbalance, but the most correct answer in this case, and I know you guys hate hearing that, but the most correct answer in this case is going to be those electrolyte imbalances. All right, the correct answer for this one is going to be swish thoroughly in the mouth for several minutes before swallowing. So, oral thrush, once you have it in the mouth, obviously it can go down your entire throat. So, by swallowing it, that's making sure that it coats the entire throat as well. Nystatin, again, all of the surfaces when it's taken orally, all of the surfaces need to be covered, and you need to coat all of those lesions. Um, you have to also make sure that nystatin, even though it's antifungal, it's not an antibiotic, you're still taking the full course. Because you really, really want to make sure that you get rid of that fungus. All right, the correct answer to this question is going to be A, metronidazole. Um, it can cause a disulfiram reaction with alcohol, so that just means they become really flushed, they become tachycardic, and they get very, very nauseous. So they have to make sure that they are avoiding alcohol while on the flagyl and for at least 48 to 72 hours, 2 hours after completion of the medication. All right, the correct answer to this one is they're reserved for resistant infections and super infections. So, carb carbapenems, they are technically broad spectrum agents, but we are specifically reserving them for very, very serious multi-microbe and resistant infections. Just because we want to limit the resistance to this medication. Antibiotics are so very difficult. It takes years and years and years and years and years to create them. I think at least the last time I checked, I think we had the first new antibiotic on the market in like 15 years. So it takes forever to make an antibiotic. And because people take them so improperly, we have such an increase in antibiotic resistance in the microbes. So that's why we really, really try to reserve some antibiotics for only certain um, conditions because we're trying to prevent more super infections and more antibiotic resistance. All right, the correct answer to this one is going to be A, to restore the gut flora and prevent super infections like C. diff. So obviously antibiotics, they disrupt the normal microbe in your gut, right? So probiotics help put back that good bacteria that was just flushed out by the antibiotics. They take out the good and the bad. And they help reduce the likelihood that someone would end up in C. diff by helping, it's gonna maintain the gut flora by putting in those probiotics. So that's how it prevents super infections. All right, the correct answer to this one is going to be A, C. diff super infection. Um, Anytime someone's on a broader spectrum antibiotic and they develop a fever and a diarrhea, especially watery, foul smelling diarrhea while they're on an antibiotic, it's most likely going to be C. diff. So obviously we're going to culture that and then most likely have to change the antibiotic to cover for the C. diff infection. All right, so the correct answer to this one. Oh, wait, sorry, I didn't give you time to answer. All right, the correct answer to this one is going to be B, the adaptive, or it's also sometimes called active immunity. So, active immunity is whenever we're exposed to any sort of antigen. So, like we're given a weakened virus in a vaccine, or we're producing our own antibodies after getting sick and stuff like that. Again, it's something that takes a long time, but that's active immunity. Innate immunity, that's the body's natural defense. So that's what you have and you're born with. Um, so technically you have it for your entire life, but it really doesn't cover you very well, right? Because when you're born, you really don't have a lot of immunity to a lot of things. Um, Passive immunity, that's when antibodies are transferred from like either breast milk or if you're getting an immunoglobulin for some reason, that's going to be passive. And the natural is, you got sick, you built up antibodies. That's natural immunity. So the correct answer for this one is again, that active immunity because they're taking a weakened version of that virus, putting it in their body, allowing the body to slowly make its own antibodies and memory cells for this virus. All right, so like I promised, I have some of those HIV questions in here as well. We don't have that many of them. So, yeah, let's just go through them really quickly. Don't worry, just like before, because you didn't get these, I put these in this video specifically. I will give you time. Also, you can pause the video to answer these questions. All right, so the correct answer to this one is going to be Kaposi sarcoma. Sarcoma is a malignancy, which means it's a form of cancer. It's specifically a vascular malignancy, and it's strongly associated with AIDS. Um, it will present, obviously, I talked about that dark purple brownish patch. Um, they look like lesions. I mean, they are lesions. Um, and they're on the mucous membranes as well as the skin. So they can have it, on their dermis as well. It doesn't have to just be in their mouth. Um, but it is technically an opportunistic infection, um, just like CMV. Even though it's a cancer, it's an opportunistic malignancy, I guess is the better term. Um, but unlike any of these other um, options, these other viruses, they don't have the same sort of characteristic lesions, so they would not be correct. All right, the correct answer to this one is going to be B, white hair-like spots on the tongue. This is called oral hairy leukoplakia, and it's caused by Epstein-Barr virus. Again, Epstein-Barr virus, it is a virus. Once you get it, it's commonly seen when individuals get mono. That is mononucleus is basically Epstein-Barr virus. But that stays with you for the rest of your life, and then you can get other things like COVID or the flu, and they reactivate it. But again, Epstein-Barr virus is kind of a sign with that leukoplakia, um, and it's actually a hallmark sign of severe immunosuppression suppression in individuals with HIV. Again, it appears as white corrugated patches on the tongue that can't be scraped off. So you try to scrape them off, they won't scrape off. Versus C, when we see that cheesy like films, we're thinking of oral thrush, right? So the difference between oral thrush and this is that you can scrape off some of that thrush, but you can't do that here. All right, the correct answer to this one is going to be C, scheduling an eye appointment. So CMV leads to retinitis, which if it's left untreated, it can actually cause blindness. So we have to make sure that, eye exams are extremely important for these individuals. Um, in the case of A, avoiding cat feces, this is more related to toxoplasmosis, which again, they should be worried about it because of their immunocompromisation with AIDS, but it's less related to CMV versus the arranged an eye exam. All right, so the correct answer to this is going to be B, candidiasis, C, I'm not even gonna try to pronounce. Yeah, I'm not gonna try to pronounce it. You guys know I can pronounce anything. And E, histoplasmosis. So, whenever we see that low of a CD4 count, they have a CD4 count that's below 100 cells per millimeter cubed. Um, we are extremely concerned about them getting those opportunistic infections. Fungal infections are extremely common with such a low CD4 count. Um, so them getting oral thrush would be very common for these individuals. Also, those other two, like histoplasmosis, that is a systemic fungal infection. And again, it's commonly seen in immunocompromised patients as well as C. Again, I'm not going to try to pronounce it, but it is also a systemic fungal infection. And we're commonly going to see these in individuals who have such a low CD4 count. All right, so the correct answer to this one is going to be D, the toxoplasmosis. Think about it almost like how, for the same reason we don't want a pregnant woman picking up cat feces or bird droppings, and sometimes, if they are pregnant, they unfortunately do have to get rid of their cat because of the risk, or their bird, because of the risk of the toxoplasmosis. So this parasitic infection, it's specifically transmitted through the inhalation, um, or sometimes even ingestion, because you can accidentally, you know, pick up the litter, not wash your hands properly, and accidentally ingest the, I think they're called oocytes, that are found in the droppings of cats and birds. So we have to make sure that we are very, very careful with cat feces, bird feces, because of the risk of toxoplasmosis. All right, and last question. You are almost there. All right, so the correct answer to this one is actually going to be B. I've switched to buying raw organic milk. Eh. Don't do that. Even if you're not immunocompromised, don't do that. There is a risk for so many different illnesses. When you're drinking raw milk, polio being one of them. So it's really just safer to not drink raw milk, even if you're not immunocompromised. But it harbors so many pathogens, which is why we pasteurize our milk. And it's extremely unsafe, especially for those who are immunocompromised. And even though A is technically correct, traveling with bottled water is going to be extremely appropriate for individuals who are traveling. Um, the correct answer for this one is I've started buying raw organic milk because it's who needs further education. Okay? I mean, organic milk. Arguably, you can also do the my neighbor just got a cat. Um, Obviously, o owning a cat, they don't even own the cat, but owning a cat is acceptable. It's acceptable for their neighbor. They just have to make sure that, like, if their neighbor asks them to watch the cat and change the litter or something like that for a week while they're on vacation, be like, hey, I might not be able to do this because of I do have AIDS and I'm at risk of a parasitic infection if I take care of your cat. I don't know how you would go about having that conversation, but that's a potential as well. But the correct answer for this one is B. And that's all I have for you guys today. Thank you so much. I hope you guys did well. And again, if you have any questions or comments, feel free to ask them. And again, thank you so much. And yeah, have a great day. Bye.